Hello guys, I'm back with my new audio series. It is from textbook of Materia Medica by Dr. S.K.Dubey. Now our first remedy is Abrotanum. It is made from southern wood ladies love. Family is composite. Proven by Cushing, Deventer, Getchell. Introduction. Abrotanum is a very useful medicine derived from the vegetable kingdom. The mother tincture is prepared from fresh leaves of the plant, which is abundantly grows in southern Europe. This is a remedy often required in cases of marasmus in children and for rheumatism caused by checked diarrhea or other secretion. Abrotanum is one of the drugs having prominent alternating actions. Clinical: chilblains, gout, hemorrhoids, hectic fever, hydrocele, indigestion, linteria, marasmus, pleurisy, rheumatism, umbilicus oozing from, etc. Spares of action: the chief center of action of Abrotanum are GI tract, nerves, mind, fibrous tissue, and serous membrane. Pathogenesis: its action on GI system causes disturbed digestion, defective assimilation, impaired nutrition, linteria, distension of abdomen, resulting in progressive emaciation and marasmus, while its action on fibrous tissue produces rheumatic and gouty manifestation. Its affection on serous membrane sets in pleurisy, hydrocele, etc. Constitution: makeup of the body. The patient, usually a child, is emaciated, especially more marked in lower extremities. Old looking face pale and wrinkled, the skin is flabby and hangs loose in fold, head is weak and the child cannot hold it up. Temperament: cruel and inhuman temperament. Relation with heat and cold, chilly patient. Miasm: Sora is in the background of all the troubles. Diathesis, tubercular diathesis. Now, guiding symptoms: great progressive wasting, especially more in the lower limbs. Ravenous appetite, eats well, loses flesh while living well. Same like iodinum, natrum mu, cyanic, tuberculinum. Linteria: stool contains undigested food particles. Alternate diarrhea and constipation like antim crude, nux vomica, sulfur, veratrum antim tart, podophyllum, chelidonium. Rheumatic conditions with heart irritation, epistaxis, bloody urine, anxiety and trembling. Rheumatism without swelling, but gout with swelling and inflammation. Rheumatism alternates with hemorrhoid and dysentery like Kali beach. Hydrocele in children, oozing of blood and moisture from navel of newborn like calcarea fos, and of urine, hyoscyamus. Angioma of the face, mind. The patient is very cruel, always want to do something cruel, irritable and ill-natured, violent and inhuman, cross and despondent, with incapacity to think. Ailments from suddenly checked diarrhea or other secretion, malnutrition, defective digestion and absorption. Particulars: marasmus, causation, impaired nutrition, defective digestion and imperfect assimilation and absorption. Character: progressive marasmus of children with marked emaciation of lower extremities. Ascending type of emaciation. The child is very weak and is unable to hold up head. Great weakness and disturbed digestion. Concomitants. There is ravenous appetite. The child eats well. Still progressive emaciation is well marked and continue to lose flesh. Along with this, there is great weakness and prostration and a kind of hectic fever. Such children usually pass lymphatic stool, suffer from alternate obstinate constipation and diarrhea. The baby is chilly, mentally irritable, and ill-natured. Abrotanum can be compared with Ithusa, Iodum, Natrum Mu, Silesia, Calcareous, Tuberculinum, and Sulfur in marasmus. We discuss in different video. Rheumatism and gout. Causation. Rheumatic affections are caused by suddenly checked diarrhea or other secretion. Character of pain. In rheumatic affection, there is excessive pain, but there is no swelling. Whereas in gout, the joints are inflamed, swollen, stiff, and very painful, with pricking sensation. Especially ankle joints and wrists are very much inflamed and highly painful, very lame and sore all over. Modalities. Aggravation at night and from cold. Amelioration by motion. Concomitants. There is painful contraction of limbs from cramps or after colic. Metastasis of rheumatism to heart is a frequent phenomena. There is high fever during rheumatic attack. Rheumatism may also alternate with heart irritation, epistaxis, bloody urine, anxiety, and trembling. Suppress the rheumatism of any joint followed by violent cardiac symptoms called for abrotanum. Abrotanum can also be thought of in itching chilled burns. It may also be of immense assistance in pleurisy after aconite and bryonia, when a pressing sensation remains in affected side, impending respiration with other symptoms of pleurisy, such as evening rise of temperature, nocturnal sweating, great susceptibility to catch cold, etc. General modality: aggravation at night and from cold, amelioration by motion. Relation: compare with Nux vomica and agaricus in chilblains. Bryonia and baryta follow abrotanum well. In pleurisy, after aconite and bryonia, abrotanum follows well.